Welcome to our clinic. I'm Dr. Peter Hansen. I wanted to show you a little bit about what we do with our treatments for pain without any drugs. Follow me, we'll have a look. Okay, come on in. When patients come to see a doctor for their pains, they're usually expecting to have a prescription. We do have prescription pads in evidence here, but I don't use them. We found a really nice way to be able to treat pain without medication, without side effects, just using needles, almost like gardening with a little small shovel. Let's have a look and see how that works. When people think of treating trigger point pain with needles, they usually think of an acupuncture needle. That's what one of those looks like right here. Very tiny, comes in a sleeve, and in it goes. Goes right through the skin, and you can see against a darker color that it's very thin. The tip of the needle is then applied right into the layer that you need to get rid of the pain. The only problem with this is it's shaped just like a knitting needle. It does not have a cutting blade to it. The needle that we use right now is different. We take this one out and we instead use this needle, same exact one that you had as a baby for your first shot ever. It's hollow, it holds fluid, as you can see here, the fluid comes through it. And as it has a beveled edge, it allows us to use it as a cutting tool, sort of the world's smallest gardening shovel. And just like in the garden, you can use it to cut through any of the scar tissue, like roots in the flower bed, and chop them into bits. It's the perfect way to get rid of what's causing trigger point pain without having to use a drug. The instructions for follow-up are very simple. This is designed, because we're not using drugs, to have movement right afterwards. So when the patient leaves here, we encourage them to walk with good posture and swing their arms. When you swing your arms, you get blood circulation back to all of these areas. Otherwise, this becomes a cement factory and chokes the muscles so they have no food, no oxygen. And then you end up with more pain and more scar tissue, the tech neck. So with this, we just simply want the patient to get back into action, swinging their arms when they walk, and come back and see us again after another week or so if pains persist.